Welcome. This is Haley Gibson here today to talk to you about how to read lab testing. For those of you who listened to my last functional nutrition workshop, you can go ahead and skip through. I am going to highlight some of my own personal story. So if you want to go ahead and skip through to about slide 9, that's where I'm going to start covering the total thyroid panel. That'll be all new content. So for those of you joining me for the first time, like I said, my name is Haley. I'm a registered nurse and functional nutritionist, and I'm very passionate about educating the public, giving them strategies to get well. So I just want to take the time to say thank you for listening. Thank you for being here and taking time out of your day. The fact that you're here tells me that you take pride in yourself and that you or someone you know is probably struggling with some type of health struggle, whether it's cancer or diabetes or heart disease, whatever it may be. And I just appreciate you taking the time to invest in your health. So this talk is really not for people who are not willing to make changes. This is lifestyle changes here. So it does take empowering yourself through knowledge and then implementing strategies into your life to make those changes. So I just want to tell you a little bit about myself. I am a friend and a health coach to all of my clients. I care about everything you're going through, not just your nutrition. I'll be your shoulder. I'll be the person you go to for advice. I will help educate you and tell you what's going on, and then also give you the best advice that I possibly can. I want to help you get to the root of your health problems. And I promise you that by making lifestyle changes and nutritional changes, you will see results. I can speak from personal experience, which we'll talk about here in a bit. So, big question here. How many people want to enjoy their life? So, medicine has been really great at prolonging our lives, making us live longer. But what is the difference between living a healthy life on no medications versus just living longer on medications? Well, I can tell you from personal experience that if we're living a life where we are taking in good nutrients and we're giving our bodies what we need and we're feeding our soul, we're connecting with nature, we're connecting with the Lord, and we are just involved in life and our relationships, and we have the nutrients that we need to support that, your relationships are going to be stronger, your quality of life is going to be better, less pain, less inflammation, and more time being spent on the relationships that matter with your parents, with your kids, with your friends, that sort of thing. So being a nurse, I have seen the other side where patients are living longer, but they are on medications. And I have to tell you, a lot of them don't even know where they are. And I'm sure that you know of some of the people I'm referring to, and it just breaks my heart. So I want to help prevent this from happening. Quality of life is truly the key here. Sure, we can put a Band-Aid on whatever's going on, but say we start gaining weight for some unexplained reason, or we have pain for some reason and we don't know where it's coming from, or our skin is starting to break out, or we're having these weird digestive problems, something's going on. Medication, and sure, the laxative will fix the constipation, or the headache medicine will fix the headache, whatever it may be. This is just putting a Band-Aid over our body trying to communicate with us. We didn't have a headache because of an aspirin deficiency or an ibuprofen deficiency. Something was going on to make that headache. So I want you to dig deeper and figure out, why am I having this headache? And really begin to address the underlying issue. I always like to ask people, are you okay with missing out on the big moments in your life because of health issues, such as missing out on playtime with the grandbabies, or going to the ball games, or going on that trip, or feeling good about yourself? There's a huge difference in aging and aging with grace. I want you to feel good about yourself. So for today, because you are listening to this webinar, I am offering a free 20-minute consultation. If you'd just like to email me at nutrition@drjockers.com, I can give you more information on this. But basically what we're going to be talking about is a little bit about your health issues, what I can do about them, see if we're a good fit to work together, and go from there. So free 20 minutes to anyone listening to this webinar. So a little bit about myself before we get started. As I mentioned before, I am a registered nurse and functional diagnostic nutritionist. So I worked at the hospital on a cardiac thoracic floor, and I loved my patient population. I saw everything from heart failure, heart attacks, strokes, any kind of esophageal cancer or thoracic cancer, which would be like lung cancer, or any kind of chest malformity where surgery was necessary. I've also seen a lot of gastrointestinal issues, a little bit of everything. So I found that I was sending my patients home on pills and telling them how to take their pills, but they wanted to know more. They wanted to know, well, why did this happen to begin with, and how can I prevent myself from coming back to the hospital? So that's where my passion truly lies. I wanted to, escort them home and redo their pantry and help them figure out how to work out and make those life changes that are going to prevent them from ending up back in the hospital. So I knew that Dr. Jockers was on to the root cause. I had been following him since the year 2010, and he was very passionate and very knowledgeable. So I truly wanted to learn from him personally. So I reached out to him and asked about a career opportunity, and that was when he told me, I'm not ready yet, but I will be. So he created this position in order for me to essentially customize plans just like he does. He trained me, and he's been a wonderful mentor and teacher. So I'm very excited to be on Dr. Jockers' team. You can find us at drjockers.com or Exodus Health Center if you're local in the Kennesaw area. So personally, I'm not only just passionate about correlating labs with symptoms and figuring out, okay, what does this mean? That is a huge part of who I am. I've always been a why asker. But I'm also very into behavior analysis. So why are we so good at giving advice? But when it comes to taking our advice and applying our knowledge, at least for me, I wasn't the best at it for a long time. So my story starts back in high school. I suffered with bulimia for 5 years. I had depression, nutritional deficiencies. I began hiding from society and becoming even more introverted than I already was. My physical health prevented me from being me. So this was a huge deal. Bulimia really altered many areas of my life. So I prayed many times. I failed many times trying to break my chains and overcome this addiction to food. I was very addicted to sugar and would binge. And for anyone out there going through this, like, my heart goes out to you, and I want to help you through this. So it wasn't until my best friend confronted me and I finally was honest and I began reflecting on myself. So I truly had to sit down and face myself in the mirror home alone and figure out, what is it about myself that I don't like, and why do I feel that way? So I had to actually apply all this positive thinking and changing the neural pathways in my brain, and then also reestablishing a new connection with food. So holding myself accountable to people that I love, talking about my story, having someone to vent to and listen to my struggles, this was a huge part. So the truth literally set me free. This was only the first step, though. I still had to address the mental and emotional aspects of the eating disorder. Like I said, it's not like cigarette smoking where you stop cigarettes, you don't touch them. You have to eat. So relearning how to eat without binging and, just relearning how to eat was a big deal. It really is for someone going through something like that. So what I did, I made a plan. I started making new neural pathways in my brain, meaning that I said positive things to myself. I looked at myself in the mirror. I said them out loud. I told them to my at the time boyfriend. I did meal planning. Meal planning was huge. If you leave someone without knowing what they're going to eat that day when they're in that kind of state to binge. So knowing healthy foods me and ready to go, this was a huge part of my healing journey. Now I've gotten better now where if I don't have food ready, I have learned how to wait and be more patient. But that's been a process. It didn't just happen overnight. Journaling was also a big part. So breaking free of my worldly obsessions was a huge deal to me, and that is something I hope to share with others and hope to help you overcome. So now I realize that not everyone listening, maybe even nobody is listening, is struggling with an eating disorder. But those trapped by the health issues actually have similar feelings, feeling hopeless about your health, feeling like you have no control, feeling like you're at the mercy of the doctor's prescription pad. Those things, I can relate to that. So, yeah. Let's talk about my physical symptoms. Some of these you could definitely be struggling with yourself. So I had severe insulin resistance. This was a big one for me. So being in nursing school, I was learning all about diabetes. And what I did was I began testing my blood sugar, before every meal and after every meal, maybe a little over the top, but that's what I did. So my fasting blood sugar in the morning was actually up to 105 to 110. That's actually considered pre-diabetic. So I'm 22 years old and I was pre-diabetic, but on the outside I looked healthy. I was very deceiving. I was not healthy at all. My insides were destroying themselves. So this was a big wake-up call for me when I found that insulin resistance and being pre-diabetic was happening. Adrenal fatigue. So I actually got my adrenal glands tested. I was no longer putting out any kind of cortisol, regardless of my stress levels. So this told me that my adrenal glands were pooped. They were done, and I was in trouble. I also had severe brain fog. It got to the point where getting out of bed, I just couldn't think anymore, and that's not okay. That is not okay for my line of work. So I also had severe sugar cravings, and I was told to go on antidepressants by a psychiatrist. Thankfully, I did not do that, but that kind of showed me that was my first run-in with the medical system where they were like, well, here, if you're depressed, take your pill. And I'm like, but why am I depressed? Shouldn't we be focusing on that? Well, I had severe nutritional deficiencies, and I also wasn't being honest with the world. So clearly, those are the reasons for my depression, and I needed to address those. And once I did, the depression completely left. So I'm so blessed and thankful to say that I've overcome that. So crippling headaches, they were definitely a big part of what held me back for a while. And I even had headaches once I stopped binging too. It took time for me to recover from these things. Severe constipation, oh my gosh, I could go a week without going to the bathroom. You talk about bloated. My stomach felt like it was stretching, and it was just terrible. It was a terrible feeling. I felt like I couldn't wear normal clothes, and not going to the bathroom is just miserable. So I developed lifestyle strategies to help me overcome this, and I also used a lot of Dr. Jocker's strategies since I've been following him for so long. So I can finally say that I feel myself again, and nutrition and lifestyle changes literally saved my life. So let's dive into what you came here for, the total thyroid panel. Today I want to discuss just basic lab work and what all the total thyroid panel covers. A lot of this you're going to get done annually with your physician, and this is something you can bring to us. We'll look over with you, but I've been asked a lot to explore lab work, so that's what I'm going to do today. The total thyroid report is a great starter panel, so it's going to look at a lipid panel, a CBC, your immune function, thyroid function, blood sugar regulation, liver function, nutritional deficiencies, and much more than that. So people experiencing these sorts of things listed up here on the slide, they would really benefit from this test. It could kind of dive into things such as low energy and weight gain, morning headaches, hair loss, dry or brittle hair. Why are all these things happening? So what we like to do is take symptoms such as these that you see and correlate them with the findings that we see on the test, and we'll talk with the client. It's so important that we treat the client, not the number. So that is something I do. I help explain lab reports to our patients. So let's look at the beginning page. The first page of the thyroid panel is going to show us a CBC, or a complete blood count with a differential, as well as platelets. So first, I just want to talk about the white blood cells, and then we'll move on to the red blood cells on the other side. All right, so if we have an increase in white blood cells, we're thinking infection. We're thinking there's something in the body that is stimulating the immune system to act, so our white blood cells are going up. We're fighting off something. If we have a decrease, this usually tells me that something's going on with a chronic infection. Your immune system is wearing down. This could also be related to some type of cancer or something going on now. White blood cells can be drastically changed by cancer formation. So I'm not going to go into details about that because I don't want to alarm anybody and make you think that you have cancer when you don't. I do advise to speak with a healthcare provider about these things, and don't just assume that you have cancer. So this is the breakdown. Neutrophils is a type of white blood cell. We typically see these increased in relation to a bacterial or candida infection. A decrease is typically related to an overwhelmed immune system, meaning chronic infection. So lymphocytes are typically elevated for a viral infection, and they're actually decreased in response to a bacterial or parasitic infection. Monocytes, these are going to be increased for a chronic infection. So TB, mono, parasite, cancer, things like that. Eosinophils, these are typically elevated in response to someone having a parasite present, maybe even an allergy. This is typically decreased whenever we see a patient struggling with alcoholism, adrenal fatigue, or using corticosteroids. And basophils, I don't really see them elevate or decrease often. If they do, it's typically related to some kind of food allergy or just some kind of allergy in general. And we also see this decrease in response to alcoholism and adrenal fatigue. So with the white blood cells, we're definitely looking for correlations and trends. None of that is absolutely definitive. You do need a culture to be sure, or a stool test or something to show you what is actually present. But those are just general guidelines of what kind of infection we're looking at. So as far as the red blood cells go, we are going to break all of these down, and those levels that you see on the right-hand side, those are going to tell you more about the shape, the size, and the color of your red blood cells, which can tell us a lot. We'll get into those in a minute. Platelets are going to tell us about our clotting ability. So if we have an increase in platelets, our blood is what is considered viscous or sticky. So this is going to put us at a higher risk for forming excessive amounts of clots. And if we have excessive amounts of clots, we're risking cutting off our blood flow to our organs. So this can result in things like heart attacks or poor blood flow to our feet and our extremities. So this can lead to anything from infection to just poor perfusion overall, which can lead to a lot of things. This can also lead to stroke. So platelets are something we look at just to see how is your clotting mechanism. So on the flip side, if you don't have enough platelets, you can have something called internal bleeding. Say you get hit or something happens inside the body, you have a vessel tear, and you don't have the platelets necessary to produce that scab, that Band-Aid, then you can actually bleed internally, and this can be life-threatening. So we do want us to have good platelet levels. All right, so let's talk about the red blood cells. The red blood cells, this is really going to give us a look into anemia, and anemia is an issue. So an increase in red blood cells, I typically just think this is probably dehydration or something going on with the kidneys. A decrease is typically related to blood loss. If you have a heavy menstrual cycle, or if you got a big cut and you lost quite a bit of blood, something like that. There's also an autoimmune hemolytic anemia where this actually destroys your blood cells, such as sickle cell disease. This can result in a decrease of red blood cells as well. Postmenopausal women typically have higher red blood cells due to they're not menstruating every month. So this is something to take into consideration. If you do have heavy menstrual cycles and anemia is a problem for you, I would advise eating more grass-fed beef and drinking more water, especially around your time of cycle. So this is going to help you produce more healthy red blood cells and also give you that need with the water for your blood pressure. So the root cause of anemia can have several different areas. We're going to talk about two of the main ones today. So there are different ways to test for anemia. This is one of the most efficient and cost-effective way is to look at ferritin, serum iron, your total iron binding capacity, and your MCV levels, as well as hemoglobin, hematocrit, MCH, MCHC, and red blood cells. These are all things that were on that previous slide. So let's talk a little about what each one of these are. So ferritin is a blood cell protein that contains iron. This is the first marker for iron depletion. So I also want you to keep in mind that it's an acute phase reactant, meaning that if you're under some kind of acute inflammatory issue, then ferritin is usually going to go up. So this is telling us more of an inflammatory issue. If it's going down, this is telling us that our iron stores are beginning to become depleted. Serum iron. Iron is actually bound to transferrin, so this is not the best indicator for total iron status. So an increase in serum iron typically tells us that there's iron overload, and a decrease is related to anemia, but we have to look at other factors. Just looking at serum iron does not tell us because iron is typically bound up in some other form. Total iron binding capacity. So this tells us our red blood cells' capacity to bind to transferrin. An increase in our iron binding capacity to iron deficiency. So this is another indicator. Okay, we're getting short with iron, but it could also be due to pregnancy or blood loss. A decrease in TIBC is likely related to chronic disease, liver disease, some type of infection, something like that. So hemoglobin is responsible for carrying oxygen from our lungs to our cells, and it's also responsible for picking up carbon dioxide, our waste product, and taking that to the lungs to be exhaled by the lungs. A decrease in hemoglobin is typically associated with anemia. Hematocrit, this is the whole blood volume that consists of red blood cells. So it's the percentage of your blood volume that is actually red blood cells. An increase in this is typically related to dehydration. If you have your water content or your plasma content go down in your blood volume, what's going to happen is the concentration of the red blood cells is going to go up. So it can appear falsely elevated. So dehydration is something I think about. Polycythemia is also another indicator. So if you have a decrease in hematocrit, this can be as a result of iron deficiency or some type of anemia happening. So this is where we really break apart is what is causing our anemia. The two main things I'm going to look at today are iron deficient anemia, also known as microcytic, and megaloblastic anemia. So the iron deficiency anemia is related to not enough iron. And you can see the picture here. It's kind of a more whiter color. It doesn't have that pretty red color a red blood cell should have. And then the megaloblastic, to the right of that, this is typically related to a methylation issue. So I'm thinking more B12 and B6 deficiencies. So MCH stands for mean corpuscular hemoglobin. This is the average mass of hemoglobin per red blood cell. So an increase in your MCH is going to tell us that you likely have a megaloblastic issue happening. So we're looking at folate and B12 being the underlying reason for an elevated MCH. If you have a decrease in MCH, this is typically related to an iron deficient anemia. MCHC, mean corpuscular hemoglobin concentration, is what this means. So a decrease is going to tell us that we likely have an iron deficiency, whereas an increase is going to be the megaloblastic. So just like the MCH, we're looking at folate and B12. So MCV stands for mean corpuscular volume. Same thing. A decrease in this is telling us probably iron deficiency, and an increase is telling us probably megaloblastic, so B12 and folate. The RDW, an increase in this one is actually going to tell us that we likely have a B12 deficiency and some kind of methylation issue, whereas a decrease is likely pointing to a B6 deficit. So these are not, just having one of these is not an indicator, okay, yes, this person has anemia. So there's different phases of diagnosing anemia. Phase 1, you're just going to have low ferritin, so this is just considered, okay, your iron is starting to go down. You need to eat more grass-fed beef. Phase 2, with an iron deficiency, this is considered non-anemia, but it is a decrease in ferritin, iron, and saturated iron, as well as an increase in total iron binding capacity. So your iron deficiency is getting worse. It is considered iron deficient anemia when we start to see a decrease in red blood cells, hemoglobin, hematocrit, MCV, MCH, MCHC, ferritin, iron saturation, and an increase in total iron binding capacity. So it takes a lot to be considered anemic. But if you continue down the path of depleted iron, you will eventually hit this point. Megaloblastic, we've already talked about that. So say you are ingesting good amounts of B12 and iron. Something that could be preventing you from absorbing this could be an imbalance in your gut microbiome. It could also be related to not enough stomach acid to actually break down these nutrients. So if you are eating well, I would advise you to begin looking into other areas, and this test will actually do that for us. So let's move on to the kidneys. The total thyroid panel does look at the kidneys. So we look at a BUN, blood urea nitrogen. So this is the nitrogen portion of urea, which is a part of protein metabolism. So an increase in BUN likely tells us there's probably dehydration going on or some kind of kidney-related issue, but a decrease in BUN tells me that you either have low muscle mass, decreased protein intake, or you even have low stomach acid and you're just not absorbing things very well. We also look at a glomerular filtration rate, GFR. So we want this to be over 60. Over 60 tells us that we have good perfusion to our organs. Once we start to see this decrease, we know that we have some type of kidney issue going on and our other organs are suffering because of it. Creatinine. This is actually from energy metabolism. It is a byproduct of muscle creatinine phosphate. An increase in creatinine is going to show us that we have some type of kidney issue going on because our kidneys are not clearing the creatinine the way that we need to, so it begins to build up in our blood. We have decreased clearance. A decrease is kind of the same thing as BUN, low muscle mass, low protein intake, that sort of thing. All right, let's look into the electrolytes. So the total thyroid panel will test sodium, potassium, chloride, calcium, and magnesium. All of these are very important electrolytes, and I just want to talk a little bit about each one. We're covering a lot of information on this total thyroid panel, so I do want you to be aware that this is a brief explanation of all of the values. These go a lot more in depth, but these are brief explanations so that we can cover it all. So sodium maintains the osmotic pressure, and it also maintains an acid-base balance and helps with nerve transmission pulses. So sodium, for those of you who have gone from a processed diet to a whole food diet, I do want you to consider adding in pink Himalayan sea salt. So we use sodium in every thought that we think, every movement we make. We are actually changing our sodium balance, and sodium is absolutely necessary for all of these things to happen. If we don't have enough, we can start to feel really sluggish and tired. So just something to be aware of. If you do cut out processed foods, you're likely going to be deficient in sodium. So an increase in sodium tells us that we have signs of dehydration, so we want to look at other areas. But it could also tell us that our adrenal glands are under a lot of stress. They're producing a lot of cortisol, and the adrenal glands are also letting out a lot of aldosterone. So aldosterone is going to make us actually retain sodium in order to retain water. So if you think of cortisol release and you have that excess Bloating going around the stomach area, this is likely related to a secretion of cortisol and aldosterone. A decrease, like I was saying, is related to likely a decrease in sodium intake, but it can also be related to just exhausted adrenal glands. No longer are they just stressed and putting out a lot of cortisol, but you're talking about adrenal fatigue now with decreased sodium because the adrenal glands have reached a point where they're not putting out good cortisol in response to your daily stressors anymore. All right, potassium. So potassium is the primary buffer within the cell. It is also the principal electrolyte inside the cell. A decrease in potassium can indicate adrenal stress. Potassium actually counterbalances sodium. So if sodium is going up, likely potassium is going to go down. So what we will do to try to figure this out is we will also look at glucose and indicators of insulin resistance. So if we have an increase in glucose in the morning, this is either due to poor blood sugar regulation and insulin resistance, or it could be that our body is under a high amount of stress and we're producing more cortisol and releasing blood sugar in order to adapt to that stress. An increase in potassium can tell us adrenal exhaustion is going on, kind of the opposite of what was going on with sodium. Sodium, if we have a decrease, we have adrenal exhaustion. Potassium is the increase for adrenal exhaustion. And this is past the point where you're submitting cortisol in an effort to adapt to the daily stressors. This is where your adrenal glands are just done. They are done producing cortisol and they've run out of stores to even produce cortisol. Diuretics can also cause you to have an increase in potassium. Kidney issues and diabetes can also cause an increase in potassium. So chloride is a key blood electrolyte as well, and it's a main component of stomach acid, which is known as hydrochloric acid. So an increase in chloride can be due to insulin resistance, stress, and an increased amount of salt due to sodium chloride. A decrease can be as a result of adrenal fatigue, B1 deficiency even, or low stomach acid is what that can be an indicator of. So if we're seeing that you're not absorbing protein well and you also have a low chloride level, this can tell us a little bit about your stomach acid. And we would give you ways to support that. So calcium, an increase in calcium can be due to an increase in thyroid function or elevated levels of vitamin D. A decrease could be related to pregnancy or decreased vitamin D or low thyroid function. So high calcium levels are common in individuals with thyroid replacement hormone. A decrease doesn't necessarily call for supplementation. We actually want to look at our thyroid functioning, our vitamin D, and our magnesium, as well as vitamin K. We don't test for vitamin K here, but vitamin D is a good indicator because vitamin D and K are actually absolutely necessary for us to absorb and utilize calcium. So if we have some kind of fluctuation in calcium, we really need to be looking at vitamin D and magnesium and phosphorus, checking out how those levels are going because they have a huge impact on calcium. Magnesium is related to your muscle contractions, protein synthesis, nucleic acid synthesis, and carbohydrate metabolism. Magnesium is usually one of the most common deficiencies I see in people who are not eating a healthy diet full of leafy greens. So an increase in magnesium can be related to hypothyroidism, and it can also decrease with diuretic usage and poor intake. An increase in adrenal stress can also increase magnesium, but I haven't seen that very often. All right, so I like this slide because it kind of puts into perspective where the human body pH should be. So you can see the little star, 7.365, ideal blood pH for humans. We do want to be around 7.3 to 7.4. And then if you look over to the left, you can kind of see the hydrochloric acid in your stomach. You actually want your stomach acid to be around a pH of 2 in order to break down our food appropriately. And I'm telling you, people who struggle with GERD or acid reflux, they're most likely struggling with too low of stomach acid. I've just seen this so frequently lately, and I just need to share that. And then lemon juice and vinegar. So these things are really great for increasing our stomach acid, lemon juice and vinegar. All right, let's talk a little bit about carbon dioxide is a buffer for our blood. So this is a waste product of respiration. Whenever we have oxygen go into our cells, we are producing carbon dioxide as a byproduct, and carbon dioxide will be carried to our lungs and we will exhale it. So shallow breathing can cause an increase in carbon dioxide and make us more acidic. An increase is typically indicative of a pulmonary problem. So there's a difference between a functional reading of CO2 and a pathological reading of CO2. So if this is an acute situation, some kind of acute pulmonary situation, you're going to have a rise in CO2. However, if you're looking at someone who's healthy, there's not an acute situation going on, and you start to see a rise in the CO2, this can actually be an indicator of what's going on with bicarbonate. Bicarbonate is considered alkaline. So whenever we have an increase in bicarbonate, we actually have an effect on CO2. So if we're becoming more alkaline, CO2 is going to go up to try to compensate for that and bring us back down to our happy neutral level or slightly alkaline level. So CO2 can actually be rising in response to an elevated bicarbonate. So you really want someone to help you go through what's been going on in your life and help you understand what would be affecting your carbon dioxide level. Something like severe vomiting or diarrhea, starvation, emphysema, diabetic acidosis, all of these things can throw off your carbon dioxide levels. Phosphorus is another one I want to look at. So phosphorus is really important for bone growth and acid-base balance as well. An increase can be related to bone fractures or bone growth or some type of kidney dye even. If you've been exposed to any kind of dye. A decrease is typically related to vitamin D deficiency or low stomach acid. So if we have some kind of bone formation issue going on, we're going to check out the stomach acid, because if you're not absorbing the nutrients you need to make your bones and your joints, then you're going to have bone and joint issues. Another thing I wanted to talk about was alkaline phosphatase. So this is an enzyme in the liver, bone, and placenta, and it functions best at a pH of 9. You can see on our little chart here that a pH of 9 is equivalent to baking soda. So we do want this to have a good environment to function in. So an increase in this is going to tell us that there's some type of growth happening. We only want to see a growth happening if a woman is pregnant or a child is growing, or if there's some type of bone break and there's growth there. But otherwise, this can be an early indicator of cancer. Once again, this is not definitive that you have cancer. It is just a possible indication. So I would want you to dig deeper into that before diagnosing yourself with cancer. A decrease in alkaline phosphatase is usually related to a vitamin C or zinc deficiency, which is huge for regulating the immune system. So in today's world, we have a ton of sources of things to congest our liver. All of these things you see here are potential liver congestants, I like to call them. So a couple things that we look at for the liver, we actually have a lot of things that we look at, so bear with me here. The first one is going to be protein. There's two types of proteins that we measure, globulins and albumin. I'll talk more about those specifically here in a minute. So an increase in just overall protein, that usually happens when you have an increase in uric acid or you have a high protein diet. Makes sense. A decrease is usually due to liver dysfunction, a congested liver due to all of these other factors that you see here, like smoking, excessive workload, soil deficient in minerals, environmental toxins, processed foods. All of these things are detoxed by your liver, and your liver is also responsible for producing a lot of things that we use in our bodies, such as protein. So the liver has a big job, and we really need to make sure we're supporting it. So another cause of low protein could be your intake, could be you just don't eat enough, or low stomach acid. So low stomach acid can be a cause of a lot of major problems going on. And the causes of low stomach acid can be an infection called H. pylori. It can be due to our diet, dysglycemia, so we're eating sugar to go up and down, big insulin spikes, things like that. Hypothyroidism can actually affect your stomach acid, and so can GI inflammation. So our stomach acid is very sensitive, and as I showed you previously, we actually need a lot of stomach acid to break down our food efficiently. So albumin is made in the liver, and it helps us retain calcium, sodium, potassium, hormones, and drugs by binding to them and preventing excretion. Albumin is the most osmotically active protein. So I had this friend, she didn't eat that much protein, and she noticed that she says she felt kind of like bloated and fluffy, and she looked like she just carried a lot of water retention. Well, I told her, why don't you eat more protein? She ate more protein for a week and a half, and she lost about 5 pounds in water weight. Osmotically active means that albumin is the osmotically active form of protein, and it's inside of our vessels, and it actually pulls water from our intracellular spaces and back into the vessel so that we can then eliminate it. Or else that is just going to sit in our intracellular spaces and look as, it comes across as just bloating and water weight retention. So that's a little bit about albumin. A decrease in this can show us that there's some type of liver dysfunction or stomach acid issue going on. Globulin, it's kind of the same thing. If we have a decrease, it's usually a liver issue or a low stomach acid. So AST and ALT, these are liver enzymes, and if we see an increase in this, that tells us that our liver is congested and it's overwhelmed and it needs some help. Ready? So moving right along. Let's talk about the lipid panel. Cardiovascular disease. Oh no, sorry. All right. So the lipid panel, we're looking at cholesterol, triglycerides, HDL, VLDL, LDL, and cholesterol ratios. So essentially, if we see a rise in cholesterol and LDL, these are considered, well, the LDL is considered our bad guys, but I want you to think of cholesterol in a different light. Cholesterol is involved in our hormone production. So if we're not eating fats, we're not going to make good, healthy cells. We're not going to make good, healthy hormones. This can cause a lot of issues. Fats are necessary in our diet, but the right kinds of fats. So if we have some kind of issue where our LDL, the bad cholesterol, is going up, we're looking at, okay, is there insulin resistance going on? Is there some type of liver congestion that is preventing me from metabolizing the LDL correctly? Is there some kind of infection going on? Because LDL has protective properties, meaning that whenever we have some type of vessel lining damage or we have some type of infection going on, LDL is going to act as a protective mechanism, and it increases in response to these things. It wants to help us overcome it, but too much LDL can be a bad thing. So triglycerides is another one we look at. Triglycerides is actually related to excess fructose. So I want you to begin thinking about everything from too much agave nectar to high fructose corn syrup to just all of the things hidden in even salad dressings. Too much fruit can contribute to this. So we really want to regulate our blood sugar whenever we see a lipid panel that's getting out of control. HDL, the good cholesterol, whenever we start to see this go low, or any of the other ones for that fact, it's usually related to malabsorption. So I'm thinking stomach acid issue or a liver congestion issue because we're not secreting enough bile to soak up those cholesterol particles. We also look at inflammatory markers on the total thyroid panel. You have CRP, which is related to chronic inflammation, C-reactive protein. You don't want that to be elevated. If it is, then you need to work on decreasing overall inflammation. So homocysteine is another one that we look at. If we have elevated levels of homocysteine, we're looking into B12, B6, magnesium, zinc, vitamin C, and B2 deficiencies. homocysteine is a very big indicator of heart disease, so we don't want that to be elevated. We need to make sure that we have all of the factors that we need to actually metabolize and use homocysteine efficiently, which are the things that I just named. Fibrinogen, whenever we have an increase in fibrinogen, we're thinking of excessive clotting. So back to the platelet theory we were talking about earlier. So blood sugar is also another big indicator for heart disease risk. We know that diabetes highly correlates with some heart disease risk. So we look at a fasting blood sugar and an A1C. The fasting blood sugar, we want to see this truly 90 or below. It's considered pre-diabetic once we reach the point of being 105 or higher, but truly we want this to be 90 or below. An A1C, I'd like to see this below 5.4. If we are above 5.4, we're having big fluctuations in our blood sugar regulation. Okay, so the total thyroid panel, obviously its name, we're testing for the proper way to test our thyroid. So mainstream medicine, unfortunately, is still only looking at your TSH, your T3, and your T4 levels. And sometimes it doesn't even look at all three of those. But this is just telling us that your thyroid is or is not producing thyroid hormone. It does not tell us about the other factors. So everything that I've just talked about can have an impact on your thyroid levels, including iron, a B12 deficiency. All of these things can impact your thyroid function. The thyroid is also very fragile when it comes to treating. So we want to be fully aware of everything that can be affecting it. So the proper way to test thyroid, I'm going to go through, in addition to things we've already looked at, we're going to also look at TSH. An increase in TSH is primarily indicative of hypothyroidism. Your thyroid stimulating hormone is kicking up, trying to wake your thyroid up. A decrease in TSH is going to tell us that we have some type of hyperthyroid going on. So T3 uptake is something else we want to look at. T3 uptake, if it is low, tells us that there's some type of estrogen dominance going on that is messing with the receptors that is needed for proper thyroid function. So estrogen dominance could be an issue in a hypothyroid case. T4 levels, you can have free T4 as well as T4. And we want to look at this because we want to know how much is bound versus how much is free. Typically, we'll see this low in hypothyroid, but I've also seen it high in hypothyroid. So when it's high in hypothyroid, I'm looking at some kind of conversion issue. This could be related to nutritional deficiencies, liver congestion, some type of GI inflammation or pathogen present, and it could also be related to the estrogen dominance that we're talking about, or antibodies. Antibodies is a big one. So we also look at T3 and free T3, kind of the same thing as T4, but typically this one, if it's hypothyroid, T3 will be low. I have seen normal T3 levels in someone presenting as hypothyroid, but what happens is you can have normal T3 levels but have antibodies present. And if you have antibodies present, that thyroid is working really hard to produce those numbers while it's being attacked by antibodies. So we definitely test for antibodies. We test for the TPO and TG antibody. So people who may be struggling with an underactive thyroid, this is very common now. So unexplained weight gain, constant fatigue, a headache in the morning, dry, flaky skin. If your cholesterol keeps going up, this can be related to your thyroid. Poor concentration, menstrual infertility problems, all of these things can be related to an underactive thyroid, and I would recommend getting this test just to see what's going on. So one last thing from the test, vitamin D. Vitamin D is a huge component for helping us build our bones, reducing immune system issues, reducing autoimmunity. It reduces the risk of breast cancer. One video that Dr. Jocker showed that I just love, there was a scientist who has been studying breast cancer her whole life. And what she did was she took cancerous cells and put them on a microscope, and then she just put vitamin D on the breast tissue. And what she saw was that the cancer receded and the cancer began to diminish just from being exposed to vitamin D, which I thought was absolutely incredible and really put into perspective how important vitamin D is for overcoming cancer and regulating the immune system. It's also huge for hormone function. That wraps up the total thyroid panel, but I do just want to ask you, how serious are you about your destiny? So the way that you're treating yourself today and every day of your life really says a lot about how serious you are about your future, how you want to function in your future. I love this slide because apparently you have to eat healthy more than once to get in shape. This is cruel and unfair, but it's so true. We have to put in the time and effort into our bodies that it deserves. I mean, how many things in your life, if you skimp out on time and effort, do they come out with good quality? They just don't. So there's plenty of for now solutions that don't work in the long run. So you can try them, but you will be facing health consequences later. And you'll try to figure out, okay, what do I do about it now? So I do advise wherever you are in life, start now. Start getting healthy now and promoting a future full of health. So you may be thinking that this won't work. I just want to remind you of where I was. Constipated, brain fog, not functioning. I had receded from all of my friends. I was not who I am today. I overcame it. I know you can too. So even regardless of what I've gone through, I've had plenty of patients who are in their 70s that struggled with, for instance, one that I'm thinking of is this lady with GERD. Is waking her up in the middle of the night. She had severe fibromyalgia, fatigue, constipation, and brain fog. And by changing her diet and adding apple cider vinegar before every meal, she finally quit having acid reflux wake her up in the middle of the night. She quit struggling with it during the day too. Her pain started going away, her constipation got better, and she's in her 70s, and she's been struggling with constipation her whole life. So she was very excited when this started happening. But I think something both of us would tell you is that this takes commitment. You have to want to. It's not going to fall in your lap. You have to want to. Now, there are people out there who can help you, like me. I can lay it out for you on a platter and tell you what to eat, how to eat it, when to eat it, and what supplements are going to be best for you. So that's essentially what I do. I hold your hand through the process, and I'm that person for you to lean on. I don't really have time to talk about the diet that we recommend, but this is what our food pyramid looks like. You can read through that. I don't want to bore you guys if you've already heard this information, and I'm also coming up on an hour of talk time, so you can read through this. But I do just want to mention common food irritants that I would remove immediately include soy, gluten, grains, sugar, corn, and even legumes. All right, last slide. So thank you guys for coming. I just want to remind you that I am giving away a free 20-minute consultation to anyone who is listening. I look forward to talking with you, and I want to help you on your journey. So if you think that you would want to speak with me, just reach out to me at nutrition@drdockers.com. We also have a lot of information available on our website. Oh, and the test that I just spoke about, you can actually find this at drjockers.com as well. There's a lab testing link, and you can click on that. There's 26 tests total right now, the total thyroid panel being the first one, so you can go check that out and see if it's right for you. Have a great day.